Yes, we can hear you, and we can see your screen.
Okay. Okay. Thank you very much for the invitation and the introduction. Hello, everyone. Today we are going to share with you our experience on ultrasound with microwave ablation. Our vascular department has been exposed to a varicose vein with microwave ablation treatment since 2020. So far, the individual number of the operation has been more than 800. And the surgical experience and surgical management of these operations has been summarized and published as articles. So in this PPT,
Hello, Dr. Huang. I'm sorry
hello.
to interrupt you. Yes, I think your presentation is too small for us to see it clearly.
Okay. Too small.
Is there any way to zoom it a little bit?
I will try. Can you see it?
We can see it, but it's just a little too small. Like, is it the same on your screen as well, the other speakers?
Sorry, this PPT has used a lot, many times. So I will maybe. What about this?
我们能看见课件就是有一点小啊，现在好一点了，现在好一点了。Okay.
Yes. But how to perform the movie? I will try. Okay.
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 Thank you.
As we saw in this PPT, the first article we saw that we have considered from the very beginning, the varicose vein treatment with the microwave ablation will be more efficiency when combined with some open surgery. That is what we are going to share today. And the second article just told us that the varicose, the venous insufficiency is a long-term, even combined with medications, to be better guaranteed the effect of the operation. The third article told us that combined with the open surgery, such as uniform stripping, would be more efficient in our treatment. And here's the choices of our treatment. Maybe I'm very sorry. Yes. We have combined our experiments and make a summary of these surgical strategies. It's mainly divided into the treatment of the main side segment and the treatment of the calf, varicose, and lesions. For example, the primary surface varicose veins, if the vessel diameter is greater than 15 millimeters, we will may consider high ligation as the main treat option. However, this depend on the intraoperative ultrasound rather than preoperative ultrasound, because the result of the varicose vein in the calf segment may become different on ultrasound after we have treated the great surface vein with microablation. So here we would like to show a case. Yeah. This is a woman, 20 years old, with two children. He came to us with a complaint with venous claudication and both lower extremities with raised legs. There is no previous medical history, and for varicose veins, we place great emphasis. You can see the sign of a leg, both leg. Yeah. And then we are very emphasized for the on the application of the preoperative venous function ultrasound, because veins are not just foreign vessels. They also have valves. Body position, respiration, and change in body cavity pressure maybe affect the volume of the veins or the function of the valves, even the function of the perforating veins. Therefore, venous ultrasound may be clearly tell you the extent of these patients' varicose varicose vein. Yeah, here is our we're asking the doctor of ultrasound do to do the details for us. We must they just need to give this detailed message for us. So therefore, a venous ultrasound must clearly tell you these things. So the full screen, yeah. Okay, so we so this ultrasound we have must cost an hour for the careful examination. So our ultrasounds suggest that the lateral formal range of the right saphenous vein was refluxing. The left major and minor saphenous veins will communicate with each other, and the left saphenous vein was significantly dilated. Yeah. So we gave the patient a marker. Can you see the marker? Make a marker for the responsible vessel, the disease vessel, and the refluxing vessel. So this on the right hand, on the left side, this is the left side of the patient. Accessory saphenous veins was the main responsible valves, and the Leeson's vessel was also in the side segment, which was returned to the distal trunk of the saphenous vein. Therefore, the surgical plan was determined as a microwave ablation of the left accessory saphenous vein, and 1% forms sclerotherapy for the venous max. This one, that is the disease vessel. And the reflux volume could be guaranteed to be filled with the form sclerotherapy. And and the other the other leg, on the left leg, the varicose vein in the calf segment was caused by the reflux on the main trunk vein and the communication of the small saphenous vein in the polycule fossa. The main trunk of the saphenous veins was mainly dilated. So the right was treated mainly from the main saphenous vein to the small saphenous vein segment. The lesion size was also chosen to be treated with 1.1% sclerosing agent to the small saphenous reflux segment. So here is the market, and we the status of our operation I is going to do. Uh, and then I will briefly describe the detail of the operations. Here's some points. For example, ultrasound guide puncture. How do we do it? An ultrasound guide local anesthesia and swelling solution injection, and then the microwave ultrasound guided microwave ablation, and then the the main point is after sclerotherapy, the target stripping. This is our uh, special point. Okay, let's first of all we say okay, look the puncture. Here is the auto plane puncture, as we can show in this movie. It's very clearly, and we can you can very easily performed on local anesthesia. and then if we use implant puncture, we can see opposite. We choose to treat responsible this here. Now here is the swelling anesthesia inject requirements for anesthesia just as the former professor told us, but we ask us to clearly see the vessel's facial. Okay, let's look at the screen and this movie. So after the injection, we must make sure all the guiding is emerge in the swelling anesthetic solution. And here is the cost of the microwave ablation. We choose to treat the responsible visual with the microwave ablation, and the choice of the aesthetics as we saw before. Yeah. Okay. And occasionally there is still some case with recanalization. So after ablation, we judge whether 3% form sclerotherapy for the trunk is needed for some cases under the ultrasound monitoring. So we after the microablation, we will inject some 3% of sclerosing agents. So regarding the injection of sclerosing agents, the amount to be used and the method of injection. Please see this table for the theory that all types of varicose vein can be benefit from sclerotherapy. As we know, the main function of foam sclerotherapy is to drive blood away from the vein and then allow the drug to fully reach the vein wall. Then, which then cause collapse and finally fibrosizations of the vein by pressure. However, inadequate sclerotherapy can be easily lead to thrombotic superficial phlebitis or varicose vein recanalization or recurrence. So we do all the foam sclerotherapy under the ultrasound monitoring. Also, we punch the vessel, and then we inject the foam scler agent and try to trade the starting point to the ending point, and then find another point to inject. So here's some highlights of sclerotherapy in our experience. I would like to share with the 0.5 and 0.6 ultrasound surveillance to understand the travel an end point of the sclerosing agent in order to determine the next injection site. Also, we must monitoring the where the form sclerosing agent to go. Yeah, the 0.6 don't remove the needle. I won't remove the needle immediately after the injection site is completely. And then all the sclerosing agent injection are performed under the surveillance after the surveillance of ultrasound. We will do some target stripping. For example, this one, we can found in the ultrasound is very complicated. So we will find this point, and this point it indicated that here may be some severe valvular insufficient. So we found this point to make some open surgery. This is very is a very easy way for us to do it because we are surgeons. So we highly recommend it that for varicose vein that remains above the skin surface in the standing or some horizontal positions. A varicose vein with severe reflux and easy to recanalization. We ask us to make a tacky stripping. For example, this one, we found it. He has a lateral branch convergence points or points of severe parectoring veins insufficiency. So we make a stripping. Okay. Here, the method of tacky stripping can be done with a single daughter, and the and the operation is very easy. So we have some some advice for the post-operative management. Eccentric compression after 3 days, and then depending on the recovery or the reflux, the decision to continue complex therapy or to choose a complex therapy program will be made. In principle, at least 4 weeks of compression therapy is recommended. Recommending follow-up based on VCSS score and ultrasonography. That's why we have built the follow criteria. If the surgery is not successful, we will evaluate the surgical plan. If the surgery is successful, the partially successful, then we enter a follow-up period. We divide the follow-up period into 3 cycles. This is the 3 cycles, and the content is just how we say above. Finally, let's look at the result of this case. As you saw in this picture, this patient was forced operative on the on the leg, and the result is excellent. Not only did we solve the patient's varicose veins and the obvious symptoms, but also we preserve the great stiffness vein, preserving a vessel that could be used as grafting. The patient was very satisfied. So 2 months later, he came back to the clinic asking for another legs treatment. And this time we do not disappoint her too. As we can see, the vein max in the polyteal fossa was completely gone. There was no scarring. Well, when it came time for her follow-up visits, he not only reported on time, come to us on time, but she also bring some new patients for us, her good friends. So finally, we would like to make a small summary. Microwave ablation surgery with sclerosing therapy and then selective tacky stripping provides a reliable and economic results. And the second, the minimally invasive surgery for primary varicose vein cannot be performed without ultrasound diagnosis or guidance. That's all. Thank you.
Thank you very much for a very interesting talk, and I'm sure we'll have lots of questions. One of the lovely things about having these webinars is that we have so different views from all around the world for the same disease. So I think we'll have quite a lot of interesting questions